Hi, I'm Daniel Hershey's Espelita, and today I'm going to perform a preparing of medication from Ampule. Ampule is a glass container usually designed to hold a single dose of drug. It has a colored marks indicating where they are pre-scored for easy opening. So traditionally, files have been used to score the ampule, but nowadays there are ampule openers available to prevent injuries from um, broken glasses. So the materials that we're going to use are the MAR, the gauze, um, antiseptic swabs, syringe with a needle, a filter needle, and a sharps container. So remember the five rights of administering of medication. So we have the right medication, the right dose, the right route, the right time, and the right patient. So I've already performed hand hygiene or hand washing and observed the appropriate infection control procedure. Now I'm going to check my MAR. So look for the name, the dose, the route, the right time, and the patient. So after that is I'm going to get my medication from the medication card. So here, there are two types of scored or um, colored um, colored line. So we have the colored line here, and the other one here is dot. So you know where to score the ampule. So next is um, I'm going to flick the ampule with my finger for several times. This is to bring down the medication down to the main portion of the bottle. Next is I'm going to um, clean the area, and next is I'm going to use a gauze to between my thumb and the neck of the ampule, and I'm going to bend it towards myself. This is to prevent the glass and the glass fragments away from myself. So in 1, 2, 3, I'm going to break the neck of the ampule. So I've already opened it, and next is I'm going to place the neck of the ampule to the sharps container. And after that is I'm going to prepare for my syringe. So I'm going to attach my syringe to the filter needle. So now this is to prevent the um, glass fragments uh, to be withdrawn with the medication. So unlike the vials, uh, ampule do not need to have a air inside the syringe. So next is I'm going to open the cap, and I'm going uh, placing the ampule on a um, on a flat surface. I'm going to place my syringe onto the center of the ampule. Then next is I'm going to withdraw the uh, amount or the dose of the medication. So I can also place it on site to obtain the remaining um, remaining amount. So after getting this, I'm going to place the ampule onto the sharps container. So right now I'm going to um, get the the air or the air bubbles from the syringe by flicking it, or I'm going to I can also um, um, inject the syringe depending on the dose of the on the dose of that I need. So next is I'm going to close or secure the syringe, uh, or I'm going to discard the syringe, the filter syringe. I'm going to place it on the sharps container, and I'm going to put it on the, or I'm going to replace it with the usual needle. Then what I'm going to do is I'm going to um, have a uh, I'm going to have the name, the dose of, and the time that I'm going to be administering it to the patient. And place it onto the syringe so that um, I can reduce the risk of error. And last is I'm going to um, I'm going to discard the things that I used, and after that is I'm going to document the findings, and I'm going to perform hand hygiene or hand washing. Thank you.